All right, Dr. Kreider, tell me what's the most important thing we can do to support you and our healthcare professionals?
Well, the most important thing you can do is to stay healthy. And the ways to do that is to, one, wash your hands. That is probably the most effective way to limit the spread of germs. The second way is to use social spacing. The CDC is currently recommending 6 feet of social spacing. Let's not shake hands. We can greet each other warmly and be very friendly and not shake hands. So let's avoid that physical contact, especially with the hands that tend to carry germs. The other thing is to limit large social gatherings. We know that that can increase the spread of germs, putting people close together, so we really need to limit that. Also, just being mindful of our elderly, limiting our face-to-face interaction with them, and using some of our other modern devices such as FaceTime and talking to them through your phone to continue to connect with them and try to help them through this period of time that we're experiencing now.
Dr. Kreider, so I am symptomatic. I'm concerned that I may have whatever. It could be the flu or whatever. What do I do?
So if you are mildly symptomatic, I highly encourage you to stay at home. In the emergency room, we are preparing for an increase in patients, but we're really want to see the more moderately to severely ill. If you have mild symptoms and suspect that you may have coronavirus or COVID-19, we encourage you to reach out by telephone to your primary care physician or another local resource to understand what your next steps should be. Treat it symptomatically. Tylenol, ibuprofen for fever, over-the-counter cough and cold medicines for the cough. But we really want to restrict visits to the emergency room for more moderately to ill patients. We still have to continue to care for our patients that have regular everyday illnesses such as appendicitis or broken arms or hips, strokes, heart attacks. We're still going to have those patients that are coming through the emergency room. So be respectful and try to manage your symptoms at home, especially if they're mild.